Scanning the room. Got the chart over there. Okay,
We're good to go. Okay, hi, my name is Raylan Renicky. I will be demonstrating how to do an intermittent straight catheterization. Okay, so before I enter the client's room, I'm going to look at the electronic health record. I'm going to look at the client's name that this is for, Mary Sanford, date of birth 11/12/98, allergies none, full code, fall risk low, 26-year-old female, just gave birth 6 hours ago vaginally, vital signs are normal, level of consciousness, she seems to be alert oriented, she's got some pain in her peri area, bladder. I guess she had a bladder scan recently and she needs to void. The order says to insert a catheter right now. Insert straight calf now. It doesn't say which size though. So before I do that, I'm going to go into the client's room and assess them. Hi, my name is Raylan. I will be your student nurse, providing privacy, hand hygiene. I have my chart with me. How are you today?
I'm okay.
Nice. Okay, before we begin, would you give me your name and date of birth, please?
Mary Sanford, 11/12/98.
Very good. Okay, nice. There we go. Do you have any known allergies?
No.
Okay, nice. That's what the chart says also. So, I hear you are having, you feel like you have to go to the bathroom?
Yes.
Okay. We did a bladder scan recently, and that confirms that you do need to use the bathroom, or you do need to void. So I'm going to assess your abdomen. Is that okay?
Yeah.
Okay. Nice. So I'm gonna leave the bed in low because that's fine for now. So I'm just gonna expose enough skin. I'm just gonna look. I'm just gonna palpate the area. Can't really tell, but the bladder scan says it's full. And I'm also going to look at the peri area just to see what we're working with. Everything looks fine, no concerns. Are you in any pain?
No, just a little discomfort.
Okay, so the procedure that was ordered by your provider is a straight catheterization, and that is going to help eliminate urine from your bladder. Some side effects or some risks with that procedure can be the risk of a urinary tract infection, but it's a sterile technique, and so we will maintain sterility. Otherwise, it's going to provide comfort and help release that urine. Does that sound okay?
Yes.
Okay, nice. So I'm gonna remove my gloves, garbage, hand hygiene. Before I walk out of the room, make sure the client's comfortable. There you go, hun. Okay, bed's in low setting, side rails up. Make sure that they have their call light. I'm heading out of the room. Open this. Oops. There we go. Okay, so we're going out of the room, pulled the curtain, did the hand hygiene stuff, did my assessment and the planning. So now I'm going to gather my supplies, and we're doing the straight calf. So I've got my straight calf kit here. The size is 14 French. It doesn't say on the order which size we're doing. Make sure that all the supplies in here. Checking for expiration date 2027. We're good. It's intact. I am also going to bring an extra pair of sterile gloves just in case these ones rip or are not the right size. I've got a check pad, and I'd probably bring like 2 or 3 with me, honestly. And I'm going to pretend I have a warm blanket. So we're going to head back into the client's room. Hello.
Hi.
It's your student nurse, Raylan. Okay, provide the privacy. Okay, we're in, do the hand hygiene. Okay, so I've got the catheter, and we're going to insert it into your bladder. Does that sound okay?
Yes.
Okay, nice. I'm gonna raise your bed. That's closed. So this procedure can be kind of uncomfortable, but ultimately it's going to help provide more comfort. Okay.
Okay.
And make sure this is at a working level. Everything's okay. Okay. So I've assessed. We did the pericare. I actually delegated that to the CNA. They've already done that step for me. So I am going to keep this moving. Okay. Before we begin, would you give me your name and date of birth, please?
Mary Sanford, 11/12/98.
And your known allergies?
None.
All right. Nice. We got the right client here. Okay. So I'm going to set this right here. Okay, so before we begin, make sure this is all set up, we're good. I'm going to pull this down, okay? I'm going to open this. I'm going to expose that. I would have clean gloves on for this, but I'm not going to apply clean gloves again. I probably have a second person with me to help. roll the client and position that well. So I do the hand hygiene again. If I didn't do that before, I did it again now. Okay, so assess them. I'm going to move your legs. Okay, you've got kind of some tubes under here. Okay, is that position okay?
Yeah.
All right. Okay. So now that is set up. Make sure they're okay. And we are going to do our hand hygiene again. We're going to open our kit. Okay, here we go. Only touching the outer inch. Okay. So I'm gonna grab my gloves. These are my spare sterile gloves just in case. Set them off to the side. These are a size large, which are too big for me. So wish us luck. Packaging appears to be intact. Only touching the outer inch. Okay, everything looks good. I'm going to do my non-dominant hand first. Try to only touch the inside of the gloves. It's tricky. Okay, looks good to me. Okay. And now I'm only going to touch the outer cuff of this one on my dominant hand. Okay, looks good. Toss that. Okay, we're not doing a UA or collecting urine, so I'm just going to toss that in the garbage. Okay, the next thing I'm going to do is set up the sheet. Hands are still sterile, not touching anything. I'm going to shiny side down. I'm going to place this in between your legs, okay? That's just catching urine. Okay, I'm going to place one of these sheets on top of your abdomen also. This other side is shinier, so we're just going to take our best guess. There we go. Okay, so now we are going to set up our stuff. Okay, not opened. Put some leaves in there. There we go. Okay, I gotta get my iodine. Shake it up. Okay. I'm gonna take them out. Set them down. Okay. Now my catheter. I'm going to lube the tip. Okay, I'm gonna set that back in there. I'm going to grab this. It's in between her legs. Okay. So since we already did the pericare, I don't have to do that. So now I'm going to clean your vagina with, or your labia with the iodine. You don't have the allergies to iodine, correct?
No.
Okay, nice. So that kind of made a little mess, but that's okay. So my hands are still sterile, so I can reach in here. So, okay, now I'm gonna spread your labia with my non-dominant hand. And we're gonna clean the far side away. Toss that. Clean near me, outside. And then we will go down the center. Make sure we get the meatus. Okay, so now that we have done that, we are going to insert the catheter, okay?
Okay.
You might feel a slight discomfort, but okay. Here we go. 1, 2, 3. I'm going to go in until urine begins to flow. Urine is now flowing. Okay. So I have not touched that with my hand. I did not touch it, but so I'm just going to keep this held here until the urine stops flowing. Okay, give her a second. Give her a second. Okay, she's done. So now I'm going to pull this out. Make sure that's nice and dry. Okay, we are done with that, so I'm going to let go. Urine, we'll measure that after I'm done cleaning her up. So now I'm just going to clean her up with this, going front back. Don't need that anymore. I'm going to take this out. Don't need that anymore. Okay, I'm going to put your legs back. You're doing all right? Any pain?
I'm okay, thank you.
Yeah. Okay, we're done with that. Put your gown down. How's your stomach, your abdomen feeling?
It's feeling all right.
Okay, nice. I'm going to put that back over there. I'm going to lower the bed. Lower your head a little bit. Here's your call light. Side rails are up. Okay, do you have any questions or anything for me?
No, I'm okay.
Okay, nice. Got the hand hygiene. I'm going to put gloves back on. I'm going to measure the urine output. 1,200 mils. Girl had to go. Go to the bathroom, dump it, toss it in the garbage. Okay, I looked at the color of the urine, observed it for any odor or anything floating in there. The consistency, everything appears to be normal, no complaints. Okay, so do you have any questions for me?
No.
Okay, I'm gonna head out of the room then.
Thank you.
Yeah, for sure. Okay, open the curtain, do the hand hygiene, and then I'm going to document everything and that's done.